Welcome to Healthy Lifestyle. I'm Lorianne Casdia. Our goal here at Healthy Lifestyle is to inspire, educate, and empower you to fulfill a healthy, emotional, spiritual, and physical life so you can feel empowered to live the life you have always wanted and dreamed. I hope everyone is staying safe out there in these uncertain times and really appreciating one another. I certainly know I am as we open back up and get to see one another again. It's so exciting. Today on our show, however, we're excited to have Dr. Bill Healy. He is the Director of Orthopedics, Northern Suffolk County, Northwell Health, and he operates out of Huntington Hospital, which, by the way, Huntington Hospital is ranked by U.S. News and World Report as one of the top 50. That's the top 1% of the hospitals in the country for orthopedic care. So that's a lot to say about you, Dr. Healy. How are you? Welcome to the show.
Well, thanks for having me. And I think it has a lot to say about our hospital and our community. So we're very proud of that.
Well, you should be very proud because the top 50% is quite a feat indeed. So what's new and exciting in what's going on here in orthopedics these days? Because it looks different right now, doesn't it?
It sure does. I think what's new and exciting is that we're starting to get back to some sense of normalcy after having been kind of out of it really since mid-March. But it's I'm not sure I love the term new normal, but to some degree it is a new normal. And we are able to start to see the patients in the office and the hospital, but under different conditions where I think really the safety and the processes we've been focusing on to get the patients back into our offices or into the operating room have really taken front stage. So during this pandemic, how has Huntington Hospital, for this new norm, and I'm not a fan of that phrase either, made it safe for surgical patients like hip and knee replacements? Because your area focuses to all the joints and sports medicine, correct? Correct.
Yeah.
I think you have to look back at the beginning of this, and I tip my hat to our leadership, Dr. Fitterman, Dr. Grasso, Dr. Scanlon, really, and really all the frontline workers at Huntington, our intensivists, our hospitalists, our therapists, respiratory, our nurses, our techs, everybody was fantastic. And Huntington, in a sense, we were pretty much ground zero in Suffolk County for COVID. And so the hospital really on a dime converted itself into a COVID hospital, an intensive care hospital. The number of beds that were opened up and the number of ventilators and ICU patients, they responded incredibly. But in so doing, this is really not, orthopedics were not front and center on this. So from our standpoint, we had to step back, certainly continue to do what we need to do from an emergent orthopedic care basis at the hospital, patients coming in who needed that care. In our offices, we had to scale back tremendously for the safety of our patients and for the safety of our staff.
Sure.
We're seeing urgent and emergent cases or post-ops, and so we had a very truncated approach. Huntington created this liaison program for those of us like myself or who are not intensivists, and I can't, quote-unquote, manage an ICU, but this liaison program utilized docs like myself who are not on the front lines, and we went in to the ICUs, helped out the staff, but probably more importantly, got together the information on the patients, and we were then able to go call the families and keep them in the loop. It was really a very successful program early on.
That's amazing. And we are so grateful for our frontline workers and for people like yourself who really put yourself up there and made sure you took care of everybody. And I've heard you use this phrase before, the 3 phases of COVID. So talk to us about that.
Sure. Well, that was the first phase. And, as this was all percolating and really nobody knew what was going on, I'll give it from a personal standpoint. I was sitting in my office on March 11th waiting to hear whether my youngest son, he plays golf in college, and whether they were about to take off on their spring break.
Sure, yeah.
And, one minute we get a phone call, everything's a go. About 2 hours later, we get a phone call that the trip is canceled, the season's canceled, school is going to be online, you have to pick up your kid tomorrow. I mean, it just ended that abruptly.
Yeah.
And it really ended that abruptly for us as far as managing our patients in the hospital, elective cases, and in the office. We then converted that quickly. So that to me was kind of the first phase. And from a Huntington Hospital standpoint, as I said earlier, they just kind of did a tremendous job. And I think you have to really look overall at Northwell Health amongst all the hospitals. You know, Michael Dowling was a leader front and center on this. And so I think we've got a lot to be proud of.
And indeed you do. Indeed you do. So what was it like as the liaison talking to the families? I'm curious about how you handled that.
It was... it's hard in those situations to use a word like fulfilling, but it was, you could see that these families, understandably so, were thirsty for information.
Yeah.
You know, they're not allowed to go see their loved ones, and these were very sick people. But in some way, we were able to convey that information to them, you know, lend them the support that they needed to hear from a healthcare professional, I think, and hopefully in some way we made that process a little bit easier.
Yeah, the communication was really good. I had some people in the hospital, and our biggest frustrations and family members, our biggest frustration was not being able to be there for them, that they were there alone, and we were assured, and the information came every morning without any delay. We would get information every single morning so that they would give us updates and things like that. And to me, that was heroic because we couldn't do anything. So we felt incredibly helpless, and we were fearful for our loved ones who were in the hospital because we didn't really know what was going on. We didn't have eyes on. So you were the family's eyes on the situation, right?
Yeah, we were. You know, this is what, like I said, as an orthopedist, I cannot run the ventilator, but this is what and there were plastic surgeons and obstetricians and gastroenterologists all doing that, and it was really a great team effort. Rich Freed, one of our gastroenterologists, really kind of led it, and I thought it was just done very well. It was kind of thinking not just about the acute medical issues, but the importance of relaying the information to the families and keeping them in the know in a timely fashion.
Yeah. And so while people had, because you are orthopedics, right? So when people were being hurt that way, not with COVID, what was that like? How did you handle that? Obviously, if it was an emergency or something like that, amongst everything else that was going on with COVID, because I know a lot of people were nervous, and it was just handled so well by Northwell Health.
It was. How, you know, you have to understand that when everything shut down, there were no longer, you know, lacrosse games and soccer practice and basketball practice, and you know, all of these things stopped all over the island. So the amount of injuries we were seeing from that plummeted.
Right.
You know, the amount of cars on the streets, you know, it was kind of easy to commute because there was nobody on the road. So the amount of MBAs and all that went down significantly because everybody was sheltering in place. But it certainly didn't mean that there weren't car accidents or that there weren't people breaking their hips, and these were things that needed to be done emergently. So we did take care of emergent patients. Certainly everything was done. Every patient was treated as if they were COVID positive, meaning full personal protective equipment and all the precautions taken.
So a friend of mine definitely has some kind of a knee injury. It occurred during COVID. Not sure how it happened. And what would you say now to people in pain from their joints? What should they be doing post-COVID?
Well, I think, one, they should be talking to their physicians. We talked about the phases. That was really the lockdown phase. And then as back in May, beginning middle of May, when they allowed certain areas, the governor was allowing certain areas to begin to do urgent cases. So, for example, in our area, Syosset Hospital had been cleared of all COVID patients, and the surgery centers, and I was utilizing the Melville Surgery Center. So what they did in a very way was collect the list of all cases that needed to be postponed, and then stratified those cases across the system based upon urgency.
Right.
And the goal was, as we were opening up, and this is not just orthopedics, this is across all surgical services, to stratify and get those urgent cases that needed to be done, colorectal, oncologic cases, things like that, get them done.
Right.
We would have a total joint replacements with people now, their pain is so severe, they're in wheelchairs, etc. Those would kind of move up onto the list, and these other facilities like SciAS at the Melville Surgery Center was doing our outpatient cases. You could have somebody with an ACL and a lock knee due to meniscus. That's an urgent case that needs to be done. So they accommodated those, and they really accommodated it beautifully. We went into the SciAS or the Melville Surgery Center. That was our experience, and both of those places opened up to us, and they were fantastic and allowed us to get those cases done. And that was part of phase two, as we were slowly opening up the offices in a very safe way. Huntington Hospital, during that period of time, I believe was opened up for urgent cases for colorectal, oncologic, and maybe gynecologic, I'm not sure. As we got later on into the next phase, where we're starting to open up more, our offices are starting to fill up, but we have processes in place where, as opposed to having a waiting room filled with patients, what we are doing is, we've removed chairs, so there is social distancing, and we're actually having our patients here do what's called curbside check, and they're calling from their cars.
Yeah.
We're letting them know when it's safe to come in. We have somebody screening them for their temperature, their history, et cetera, and we're, everybody's in their PPEs and the patients as well, and so that's how, that's what I talked about, our new normal. That's how we're seeing patients now, and we are getting them in. And the other thing that we are doing and I know I did not do before, I don't think most people did, we are doing a tremendous amount of telemedicine. And this is a great way to follow up on patients without bringing them into the office. It de-densifies the office. We can review MRIs and patients who are post-ops down the road, patients who are making decisions, are they going into therapy, et cetera. So that's been a tremendous boost, and I think that is something that is going to be here to stay.
I'm so glad that that's here to stay. I know back in, believe it or not, in the 90s, my brother is a neonatologist. He opened up the first neonatal unit down south, and he had it built and set up so that each child had their own little area, and it had a camera so that he could send, because his biggest concern was the parents were getting so fatigued because they were so worried and they weren't going home because they didn't want to leave their child, understandably. And so it enabled them, it empowered them to see their baby. If they woke up at 2:00 in the morning, would be able to look at their baby, and he would have teleconferences with them so that he could keep the baby safe, he could keep his staff safe, because sometimes they'd come in with colds, the parents would, and or not feeling well, and they were run down, so they're catching things, and then they were getting his baby sicker. So he came up with this concept, and he's been doing that since the 90s. And I'm just so glad that now this is a new norm, that you can pick up the phone and talk to someone, talk about symptoms, and then go get those tests done, and you can read them. It's probably a better use of your time too, as far as being able to pick up a phone and have a conversation with someone. Do you like it? Do you prefer that?
I do like it. It's been an education going forward. I mean, I was a parent with a child in the neonatal ICU in the early 90s, so I certainly would have appreciated that.
Yeah, so you understand
that.
Yeah.
As far as in my office here, I think it's an excellent tool. Sometimes it's very difficult for patients to come in, and in a busy office, I get the guilt when somebody's waiting an hour just to tell me they're doing well, or, I was going to send them to physical therapy anyway. This is a great way. I believe it's easier for the patients. It's easier for me, and it's a way of, like I said before, de-densifying the office. You don't have that volume coming through. So yeah. I think it's here to stay, certainly, and I think that, they're like everything else, in and amongst everything, and you have to look at the positives. And I think that
absolutely.
positives in this.
Yeah, absolutely. And we have to be, that's very mindful of everyone's time. So if you get caught in a surgery or something happens, you don't have to feel that guilt because it's a phone call to say, listen, we're going to just push this call back. And they can continue doing what they're doing as opposed to be waiting in a waiting room someplace. So I love those benefits and also having it clear for when somebody has an urgency, they can come right in and see you directly. So let me ask you another question. What do you attribute to Huntington Hospital's orthopedics being among the top 1% in the entire country? What do you attribute that to?
I'll tell you, I think, I grew up in this town. My father was an orthopedist, so there's been a Healy in the Department of Orthopedics going back to 1968. Huntington is a very unique town, and there's a lot of second and third generation people here who don't want to leave. And certainly Huntington is not a major facility, tertiary care like North Shore Manhasset or Long Island Jewish, but it is a place that has got a tremendous amount of pride. And if you look at the staff, and from physicians to administration to nursing staff, social workers, et cetera, everybody works together incredibly well. And I truly believe certainly in the last 10 years, we have worked very hard at taking our department to a new level. But that comes with assists. I mean, we get an assist from our nursing staff. They're Magnet Award-winning nurses. They're recognized nationally as one of the few hospitals that have won that award so many times.
Yeah.
We have engaged patients. We have an administration that supports us. We were the first hospital in New York State to get the Joint Commission's Gold Medal for our total hip and knee program. We're the only one that's gotten it 5 times running. It's a 2-year and we just got our advanced certification this past year. And that takes, again, a lot of person hours, putting it all together, utilizing medical practices. And I think we also, we learn from our brethren throughout the system. I sit on something called the Joint Preservation and Reconstructive Committee across the system, and we get together, every 6 weeks or so, share best practices at each place. I mean, it's really impressive how something so big as Northwell can affect each place individually, so small and locally. And I think all of those factors in play have really kind of brought us to where we are in the position now that we're very proud of.
As you should be, without a doubt, without a doubt. So in the last few minutes, Doc, what would you say to people nervous about hospitals and surgeries right now?
So we'll talk about phase 3. Just last week, I was able to get back to do urgent and semi-urgent orthopedic cases at Huntington. So Huntington has opened up. I will tell you that our staff at Huntington and our leadership, led by Dr. Fitterman and Dr. Grasso, have really set Huntington up, and they have these safe pathways in place. They have enhanced environmental cleaning procedures. Everybody, there's not a lack of PPEs for everybody, staff and patients alike. Everybody who's going in for surgery is going to be tested for COVID within 48 hours of their surgery. It's safer for the patients and safer for the staff. And if they are positive, they will not proceed at that time until they are COVID negative. There are daily symptom screening policies for all staff members. There's going to be non-COVID care units. So when a patient hits the hospital for their pre-admission testing or they come in for surgery, they will be escorted through and they will not cross any COVID care units whatsoever from the time they hit the hospital to the time that they are discharged. So I live in this community. I've been here my whole life. I would not take a family member, a friend, a patient to the hospital if I thought it was unsafe, and I feel very comfortable recommending to my patients now.
Yeah, that's outstanding. Yeah, I'm understanding and hearing that it's really great. I've actually been in one of the facilities, and they check your temperature as soon as you walk in. They keep you safe. There's distancing. They ask you to keep the masks on. If you don't have one, they give you one. So there's gel everywhere. So it's really it made me feel very safe and confident that I was going to be okay, and I was going in for something different than COVID. It had nothing to do with COVID. So it's really nice to hear that the hospital is taking those steps, and you're doing what you do, Dr. Healy. I really want to thank you so much for joining us today on Healthy Lifestyle.
Thank you for having me.
It's absolutely our pleasure. And we are going to take a short little break and come back and speak to Dr. Sood further about some things with the Northwell Health System. So stay tuned. We will be right back. Welcome back to Healthy Lifestyle. I'm Lori Ann. If you have any questions, comments, or ideas, please let us know. We'd like to hear more about them. And you can email us at healthylifestylewithla@gmail.com. That's healthylifestylewithla@gmail.com. And of course, follow us on social media. We really appreciate that you are. We love seeing everybody there. And it's at Healthy Lifestyle with LA. And we do answer all of your emails and have actually had guests on as a result of your requests. So keep them coming. We love it. As soon as we're allowed, we will be doing the live Facebook stream. So that should be coming soon, I hope. And I'm so excited because our second half, because this is our Northwell Health Day, our second half is with Dr. Sunil Sood, who is the pediatrician specializing in infectious diseases, Professor of Pediatrics and Chair of Pediatrics at Northwell Southside Hospital. We are so pleased to have you on, Doc.
Good afternoon.
Good afternoon. So let's talk about everything. So I know you're an ambassador for science, right? And you're very concerned about all different areas of the science movement, right? And also you have concerns about the public distrust of governmental organizations who really only are there to serve to help us, correct?
That's correct.
Yeah. So this is an interesting time in our history, don't you think?
I think it is. And, I think physicians and not just physicians, but, scientists on all aspects. In this case, we can talk about infectious diseases, since that's been on everybody's minds. I feel like physicians and even public health experts spend a good amount of their time trying to battle misinformation. And misinformation, which, of course, in our electronic age, spreads, sometimes, we joke, faster than true information.
Yeah.
And there are some true anti-science movements out there, which, the one that was, as pediatricians, most familiar about prior to this was, of course, people who oppose vaccines. And that has implications for if and when we actually get a coronavirus vaccine. And I have another example of a perfectly good vaccine, which was very relevant to our local risk, which is the Lyme disease vaccine, which is a perfectly good vaccine that I was involved with recruiting children on the east end of Long Island.
Yeah.
And it was withdrawn for nothing to do with safety reasons by activists who essentially gave the manufacturers a lot of pause for thought as to whether they should even market the vaccine. And it was a completely anti-science sub-movement that led to withdrawal voluntarily of the vaccine. However, if you Google it, it's going to come up as the vaccine was recalled due to safety reasons, and that really wasn't true. So we're hoping that new coronavirus vaccines don't meet that fate. And we are also, as you know, very, very concerned that there is statistics now from the CDC that fewer children are getting their routine immunizations because of the slowdown and fears and lack of access to services during the coronavirus pandemic. So that could lead to secondary epidemics of infectious diseases.
Understood. So what do you say to parents concerned about vaccines?
Well, I would say that we have a very long history of safety of vaccines, and that every minor or major concern that the public as well as the scientific community has had about the safety of individual vaccines is looked at very thoroughly by many different institutions. One is the National Institute of Medicine. Then there's some very respected medical institutions such as Johns Hopkins, which have a Vaccine Safety Institute. Then there's the American Academy of Pediatrics, which has a Committee on Infectious Diseases. And so whenever there is a true undesirable effect of a vaccine, that vaccine will be not recommended anymore. So scientific vetting and fact-based, evidence-based checking of not just vaccines but all medications is a constant process. And parents can be assured because their pediatrician is almost always a member of the American Academy of Pediatrics, that the pediatrician is practicing evidence-based vaccine administration.
So what would you say to parents nervous about going to the pediatrician and getting shots because of COVID?
So to my knowledge, and at least at the Northwell pediatric practices, most of the outpatient offices have now separated sick visit hours from well baby hours. And that's very reassuring because you obviously worry when you go into a doctor's office if you're going to catch something from someone in the waiting room. Even as adults, we have that concern. We had that concern even before this pandemic.
Yeah, actually, so, I was fortunate enough to have a pediatrician for my boys who had separations of rooms. He had the sick patients on one side in a different room than he had the well care patients. And that was always wonderful, to the point where I wish my personal doctor would have done that, because sometimes I was sitting next to somebody who was violently ill, and I always wondered if my immune system was already compromised, if that was not going to make it even worse. So
I agree. I've been in some very crowded doctor's offices myself.
Yeah.
But the other thing that I know Northwell is doing is really safe care practices with meticulous attention to cleaning between patients checking in a sort of contactless fashion, really from the car in most cases. And empty, keeping the waiting rooms empty and keeping the flow, such that the patient goes directly into the room, the consultation room. So I think it's currently much safer than it's been with regard to infectious disease exposure in medical facilities of all types because of our heightened protocols.
It seems like those heightened protocols, as you refer to them, are really, really being very effective. So here's another question for you. I keep hearing about MIS-C. Is this real? Is it going away? Is it here to stay? What about that? Right.
So it is real. It was a surprise to us practicing pediatrics and pediatric infectious diseases. So, of course, we knew, and we still know, that the actual disease from this novel coronavirus, the disease being called COVID, produces this severe pneumonia with other complications, but it predominantly affects adults, which is the exact opposite of what we saw during the last pandemic, which was the H1N1 flu pandemic in 2009. And we sort of felt bad about, obviously, the bigger situation, but almost were a little relieved to see that it wasn't affecting children that much. Then we got a little surprise, which I think, in my estimation, began about 4 weeks after that peak curve that we all saw. And we started seeing more children with something we normally see in the spring, which is Kawasaki disease.
Okay.
And Kawasaki disease is a condition where you have several days of fever and you have many other symptoms like a rash and red eyes and swollen lips and hands and feet. And we normally expect to see it this time of the year. It's always been postulated to have been triggered by a virus infection several weeks before, but no one has actually identified the culprit virus.
Right.
So then we put two and two together and said, well, maybe this year it's the coronavirus that's triggering Kawasaki disease, and we're just seeing an uptick in those cases.
Oh, see, now, I thought I had Kawasaki disease because I have a motorcycle, but we're not talking the same thing, are we?
Right. That's how we explain it to parents. So I said, Kawasaki is like motorcycle. So, of course, it's named after Dr. Kawasaki, who described it in Japan more than 50 years ago. Wow. Like I said, we still haven't identified the trigger, but this year the trigger was probably this virus. But then it really morphed into different manifestations, and that's why it was renamed by the CDC as multi-system inflammatory syndrome. So in the following few weeks, we didn't see the younger kids with the severe Kawasaki, the classical Kawasaki symptoms.
Right.
We started seeing some older children with most as if they came in with appendicitis. And some other variations. What was frightening is that many of these children briefly had to go into the pediatric intensive care unit, although they all did well and needed some medications to support their heart. So I think our theory that this was just a 4 to 6 week delay from the peak pandemic curve turned out to be correct, because as that curve has flattened, this mini curve of MISC has also seemed to have flattened. So now I don't think we're seeing children every day with this, and we're hoping that we just see the end of it. So it is an unexplained immune system reaction that's delayed following what the child probably had an asymptomatic coronavirus infection several weeks prior, and then they came in with these manifestations. But again, we should look for this in the future if there happen to be a resurgence of the coronavirus infection, because this is what I call a lagging indicator. So this may happen something 4 to 6 weeks later. And so we will be looking out for it in the fall, hoping, of course, that it doesn't come back in such large numbers.
Yeah. And you mentioned before acute flaccid, I think you said myelitis. Myelitis. Right. So what is that? What do parents need to know about that?
So that is actually and a paralysis. Often it is a paralysis. Sometimes it's a weakness of one or more arms. Sometimes it can involve weakness of arms and or legs. That can happen. Well, we know it happens, again, similar to the discussion we just had about the MISC, several weeks after having a mild viral infection. And in that case, the virus infection is usually a common gastrointestinal virus or stomach virus. It's actually a group of stomach viruses called enteroviruses. Parents know this more as a cause of hand, foot, mouth, or Coxsackie infections. Sure. Yeah, and these happen more in the summertime. So what's happened is every other year, somewhat predictably, since 2014 in the United States, the CDC has monitored reports of this muscle weakness, muscle and nerve weakness really is what it is, that has occurred days to weeks after summer enterovirus season. And so they tend to happen in the fall. And we didn't have the peak in 2019. And so just by the epidemic curves, we should anticipate it in 2020. The good news here may be that and there is some data to suggest that the social distancing that's been so effective for containing the coronavirus may actually prevent or delay the onset or an outbreak of acute flaccid myelitis, or AFM as it's known for short. So again, we as pediatricians and infectious disease doctors always hope for the best, but are prepared to see complications. And so we have a protocol in place at our Cohen Children's Hospital and throughout our pediatric service line of Northwell Health to be able to recognize and intervene early should it happen this year.
I find it interesting that we're able to see these patterns because it looks like every 5 years or so we have these really bad pandemics, and then and these ancillary every 2 years, similar to the MISC and the AFM, that those are happening alternating years. Do you have any theory behind that? Why that goes?
No, nobody. And I'm just quoting the experts who have been thinking about this deeply for a number of years. It is almost impossible for them to explain why these periodic patterns occur. We just don't know why it would skip a year, for example. And every country is a little different, so different countries may be on different cycles.
Yeah.
But it's just something for parents to be aware of. Again, don't hesitate to seek medical care. If for some reason, a child's arm seems weak, it's worth just going in and getting it checked out, because they can be assured that at least at Northwell Health, we are aware and will be ruling out any serious conditions.
Which is really important, because if you know what to look for when you hear people have those kind of symptoms, you know that it could be one of these things. So it's really important that you know that Northwell Health and the doctors within the system are aware of it. So it makes it for a good, quick diagnosis as well, which means you can do something about it. So to me, that's always empowering. Information is always empowering.
Yes, it is.
So as people are trying to enjoy, because we're in those summer months that I love being outdoors and I love to hike and walk and be outside. I have woods in my backyard, so it begs the question: what do we need to be mindful of regarding ticks?
Yes, and so we on Long Island are one of the hotspots for tick-borne diseases of many different kinds. So if you look at the tick distribution maps or Lyme disease maps of the United States, we know that from Maine down all the way to Virginia on the eastern seaboard, there just is the climate and the conditions to foster high number of tick populations. And so, of course, Lyme disease is the one that's the most known about. Well, Lyme disease is the most common, but it's actually also the most treatable. What I'm often concerned about is that people may notice or pull off a tick from their child's body, and it's actually not a deer tick, but they presume that it is. And there's at least two other kinds of ticks, and residents of the east ends of Long Island actually are very familiar with these ticks. One is called a dog tick, the other is a lone star tick. And these ticks carry different microorganisms. They cause different symptoms. Those infections result in different symptoms. The one that people may have heard of is Rocky Mountain spotted fever.
Sure.
And there's a few others. So it's very important to look for and actually save the tick and submit it actually to the lab by your doctor for identification of the tick. Because that'll actually give the physician a clue as to what symptoms to look for should the child develop a tick-borne illness.
Is there a delay? Is there a delay in that kind of illness that may come from a bite of a tick? Can you get bitten a week or 2 weeks before and then suddenly fall ill?
Certainly, yes. And so we usually say if you found a tick on yourself, like I said, if possible, save it and have the tick identified. We actually don't test the tick for Lyme disease or anything else. We just want the species identified, and commercial labs do that. But then we usually say to be safe, monitor for about a month for fever, rash, headache, those being three common symptoms that could occur in a variety of different tick-borne infections. So there is a delay that typically would be about 2 weeks, but could stretch to about 4 weeks.
So, wow. So are there any other children's summer illnesses parents should be aware of, Doc, while we still have you in these last few minutes?
Right. So just to remind people that respiratory viruses do not only circulate in the winter. We have milder infections that occur in children in the summer, which includes things like walking pneumonia, things that would not necessarily land a child in the hospital, but again, still need to seek medical care through your primary care provider. And there are Usually in the late summer, a lot of mosquito-borne illnesses. Again, West Nile is the most well-known of it, but turns out there are, again, a host of other viral infections that are transmitted by mosquitoes that can occur in our area right here in the Northeast and especially on Long Island. So one practical piece of advice I give to all parents is when you're preventing bug bites, use the right repellent, and you're actually preventing both tick bites and mosquito bites when you do that. And everybody knows about spraying DEET. Unfortunately, DEET percentages in many preparations are too low to be effective, so you want to go with 25 to 40% DEET preparations. And the second thing is if you're able to pre-treat your clothes with something called Permethrin, which is freely available in garden stores, which is not used on the skin, but can treat clothes, gear, tents, hats, backpacks, and really are effective at repelling both mosquitoes and ticks.
And what's the name of that product again?
It's called Permethrin, so Permethrin, Permethrin.
Understood. That's a really good piece of information, especially if you're going to be out in the woods or in an area that you think is a high tick or bug area. So that pre-treatment is really important. I can't thank you enough, Dr. Sood, for being on and sharing all this information. We really appreciate you being with us and helping us enlighten us with all of this information. It's overwhelming as a parent, so we really appreciate you being there. So thank you for being on, and thank you all for joining us today on Healthy Lifestyle. My heart is lifted by sharing this time with you, and I want to thank both of our guests today, and I also want to remind you we're here to serve one another. So please step out of your day, take a moment and do a little something for someone else. It's really important. It doesn't take a lot of time. Thank you again for joining us on Healthy Lifestyle. Play a higher role, serve a higher purpose, show up for you, and show up big.